Every month the economy is shut down costs the state billions of dollars. And so if we can spend millions of dollars now to save billions of dollars later, that's something we should do. If your house is on fire, you don't worry about water damage and mold, you put the fire out. And that's what we need to do.
Hi, everyone. Thanks for joining us. I have an exciting interview with two UH scholars who've been working on a new report called Crush the Curve, Urgent Steps Hawaii Can Take to Contain the COVID-19 Pandemic. And I'll have them introduce themselves, and we'll start with Seiji Yamada. Could you just give us a little bit of a sense of your background and what you've worked on?
Hi, my name is Seiji Yamada. I'm a family physician, and I mostly work in primary care. I teach at the University of Hawai John A. Burns School of Medicine in the Department of Family Medicine and Community Health. I also work out in the community at the primary care clinics of Hawaii. And I've have some interest and background in disaster response and preparedness. And so I've been working on the coronavirus epidemic, mostly in terms of like trying to see patients and get them appropriately screened and such.
And Robert Perkinson.
I'm a professor at Manoa. I'm a specialist in U.S. political history and public policy and criminal justice. And I'm increasingly interested in the crisis response from a policy point of view. How can we do the best we can as institutions and as state and city government?
Great, and I'm Colin Moore. I'm the director of the Public Policy Center at UH Manoa, and I'm going to be asking these two scholars some questions about this report. So I'll start with you, Robert, and could you just give me a brief sense about how this is different? How are you advocating a more aggressive approach, and how would you change what the state has been doing so far?
Well, we've done a pretty good job in some ways so far in shutting down largely travel from out of state. Has given Hawaii an opportunity that almost no other jurisdictions have had to really contemplate the next steps. And that's just what we haven't done yet. We haven't really gone from shutting everything down to aggressively increasing testing, to investigating every case and make sure we find them all, and to isolating and quarantine to make sure that the pace of infection slows. Once we do all of those things, public health officials are almost unanimous in agreeing that we can start really thinking about and planning for opening up the economy. Until we do those things, we can't.
And Seiji, I'll ask you this question. Does Hawaii have some particular challenges or even advantages in confronting this pandemic?
Well, certainly the advantages are its insularity, in that the closest continent is 2,000 miles away. And so if we're able to close our borders to folks coming in, and we have a good amount of control that the 48 contiguous states do not. I'd say a disadvantage might be that certainly in terms of the economy, our dependence on both tourism and the presence of the military, both of which seem to be quite susceptible to infection with the coronavirus, makes it challenging to reopen our economy to those aspects.
Now, one of the things, and I'll ask you this question again, Seiji, that this report brings up is that countries like South Korea and New Zealand can be used as a model. What have they been doing that the United States hasn't been doing?
Well, if you recall, South Korea was one of the countries that had a very early outbreak after China, and they had the advantage of, number one, the experience of SARS in 2002, 2003, as well as the Middle East respiratory virus, MERS. And so they've dealt with severe coronaviruses, and they have a very robust public health infrastructure that involves the use of technology, such as being able to trace people through electronic devices such as their own cell phones. The government keeps very close track of anybody that's infected and is able to warn people that are exposed. They're really putting that to use. And while we, on the other hand, really throughout the United States have kind of gone back to paper and pencil, interviewing folks and trying to piece together their contacts through interviewing them and such.
Now, Robert, I know that it wasn't just the two of you who thought up these ideas. I mean, you interviewed a lot of folks, and so I wonder if you could just tell me a little bit about how this report came together. Who were you talking to? Where did these ideas come from?
Well, we, tried to look to the recommendations of public health experts who around the world are issuing guidelines and reports, and tried to look for the common ground among those recommendations. And then also, I run a speaker series at UH, and, with the suggestions of you two, actually, I found a lot of other people to talk to: virologists, geriatric care physicians, epidemiologists, public health officers. We tried to run these ideas by people involved in the state's emergency response to make sure that we were presenting ideas that were sound, viable. Really, these ideas in this report are not new. This is the basic public health blueprint that people have been refining since the 1918 pandemic. Mm-hmm. And steps are pretty basic. It's just we have not taken them all yet, and we really need to do it.
So there's 4 major recommendations, or 4 areas where you advocate a more aggressive approach. And so I thought maybe I could just walk through those. And the first is around physical distancing, something we're already doing and that the state was a relatively early adopter of. But you have a couple of ideas about how that could be expanded. And Robert, I'll ask you this question. What should the state be doing and the city and county be doing that they're not doing right now?
Well, we've done a fairly good job of shutting things down, but traffic and work is not down probably as much as it needs to be to keep us safe in this initial phase while we kind of develop the tools and the capacity to move to the next steps. The tricky bit is you want to encourage people to distance physically from each other, but you don't want to, break society down or make people alone or depressed. And you also want to build trust in government at the same time. So enforcement, in my view, should be visible, but should also be judicious and restrained and thoughtful and logical. So, concentration of police resources on the most likely sites of infection, but not in such a way that makes people feel persecuted or antagonistic.
And how do you think the police should balance that? I mean, how do we do this without violating people's civil rights?
I think that there are some ways to combine the coercive authority and techniques available to the state without becoming overly punitive. Like you can do, for instance, there are ways to do permitting and regulations about the number of people allowed into a store, and even checkpoints on minor roads. But that doesn't mean you have to be, if you encounter at this checkpoint a group of people saying, oh, we're going to the beach or we're going to a party, that doesn't mean that they have to all be arrested. You can just tell them to go home. Because the police response does not have to shut down unwise activity to zero in order to arrest the rate of infection. We just have to take steps to symbolically communicate to the population that this is important, the stakes are high. And I think it's possible to do most of that without, throwing a bunch of people in jail or in really involving the courts in any kind of formal way. Sure, maybe there's a group of tourists who come and they're just wantonly defying public health, and maybe they need to have a fine at some point. But, I think there are non-coercive techniques that can be employed first.
Seiji, since you're a physician, I'm going to ask you the next two areas, because I think there's a lot of confusion among people who are less familiar with medical terminology about diagnostic testing and contact tracing. I think it's understood that the U.S. needs more of these tests, and we don't have enough. But could you unpack that a little bit? Why would more diagnostic testing be helpful?
One thing about whenever an outbreak starts, the most severe cases come to the attention of the medical authorities. And so we first learned about the first 41 cases. They were patients that had very severe pneumonia, cough and fever and shortness of breath. And so that was our kind of initial impression of what this disease consists of. As we have more experience with the virus, we see that people who contract the virus can have a whole gamut of, actually starting from asymptomatic, progressing to a little mild illness, to, of course, those very severe cases that can lead to death. And so, unfortunately, the virus is very tricky. One can be completely asymptomatic, still be carrying virus, and still be transmitting it to others. And so, when we find the person who has the virus, then we actually want to do testing of all the people that have been in close contact with that person over the past few days before that person became sick. And so that's the contact tracing part. But to go back to the diagnostic testing, the test that we're using primarily is a test for the live virus itself. And so this is the one where you get the nasal swab stuck all the way back in the back of your nose, and then you get an answer. Could be as quick as a day if the sample gets sent to the continent and has to be processed there. It has been as long as 9 or 10 days for some people, which is obviously much too long of a turnaround time. Given that we can't go around testing the entire population of asymptomatic people, my take on this is that we need to test people that have relatively mild symptoms. They might have influenza-like symptoms, or maybe even a cold, just a cold, an acute cold, maybe with a little fever. People who have those sorts of symptoms, we want to test them, because if we find some 2% or 1%, we need to find that 1 or 2% of people that have those sorts of symptoms. We do need to isolate them, and then we need to test their contacts. How significant of a contact, like how much time did they spend, how much distance was between them, that's kind of a judgment call. Testing more widely, testing more of those contacts is something we need to do.
One quick scale thing, there's a new report out today. I think a group of researchers at Harvard kind of went through every state and did modeling, and they determined that the per capita rate of testing in Hawaii needs to be 3 times higher than it is now on a daily basis. Now, that's not something we can do right away, but that at least should be the objective, and we need to make sure at least that the state resources are deployed toward that target.
And in this report, you have a recommendation about how the state can get the personnel to do this contact tracing and maybe even assist with the testing.
Well, I think one thing that's quite clear, both in testing and even more so in contact tracing, is that with the present technology and privacy landscape of the United States, we have to do the old-fashioned contact tracing, which is not all a bad thing, because often contact tracing works best when the person doing the investigation has the ability to gain the trust of the individual who tests positive and also the contacts. But, the CDC and other public health officials are now estimating that in order to fight this disease, we need to raise an army of contact tracers. In order to really have the capacity to isolate every case, track them down, and shut down the chain of infection, we have to have a large number of employees. And that probably means hundreds of new employees in the state of Hawaii working on contact tracing full-time. And that means that, either the state has to activate the National Guard or do a radical redeployment of personnel among state agencies, or better, because there's a lot of people out of work right now, immediately begin hiring large numbers of people and begin training them. And if 6 months from here, a year from now, 2 years from now, whenever a vaccine comes online, if it turns out we didn't need all of that capacity, just like sometimes the military doesn't need, every single member of its armed forces to deal with every emergency, that's great news.
Now, the last area of this report is really the oldest form of disease prevention in some way, which is quarantine and isolation, something that humans have been using at least since the 14th century to limit disease transmission. And Hawaii obviously is already doing this. We're already under some forms of isolation orders, and there's a self-quarantine if you arrive in the island for 14 days. But you have proposed maybe some ways to make this easier, maybe to improve the ability of people to self-isolate. And Robert, could you tell me a little bit about that? Because it actually involves one of Hawaii's, in some ways, its greatest strengths in fighting this.
Yeah, the two greatest strengths I think we have are geographic isolation, and we have infrastructure that exceeds the needs of our regular resident population, particularly with respect to hotels. We have tens of thousands of empty hotel rooms and out-of-work hotel workers. That is a gift that we have to containing this outbreak. And therefore, everyone who tests positive, all of the needs to have the ability to isolate there at government expense until they are no longer infectious, according to CDC guidelines. First responders who are placing themselves at great risk, some of them won't want to exercise this possibility, that's fine, but they should have the ability to, let's say they're living with at-risk parents, to also be staying in these facilities for the duration of the crisis. Some very vulnerable members of our community, members of long-term care homes who don't need around-the-clock care could also be temporarily relocated. We really need, if we are to lock down this virus, we need to not take someone who tests positive and send them home to self-isolate with their grandparents. We need to give them the ability to ride out the course of their illness and no longer be infectious where they don't endanger anyone else.
Seiji, do you think this is the best we can do right now? I mean, how long do you think it'll be before we have some sort of treatment or even a vaccine?
Well, the trials of medication are taking place now, and we don't have any reliable positive results yet. So we're keeping our fingers crossed. Dr. Fauci suggests that it'll be 12 to 18 months before we have a vaccine. I think some vaccine developer types think that that's actually pretty optimistic, and it may be a lot longer. I do want to say something about the concept of isolation. So isolation is what we do for the person who is actually infected with a virus. And in public health lingo, that's actually separate from quarantine, which is what we do with people that are exposed or may be exposed, but not yet known to be actually infected. And so the person that's infected, again, is quite infectious, and so needs to be in his or her own room with a door that can be closed, needs to have his or her own bathroom, and needs to have food brought to the room and left outside the door on a tray until that person is no longer infectious. And that's kind of taking isolation seriously. As Robert mentioned earlier, that may be impossible for many of our residents in Hawaii. We have a lot of multi-generational families, which of course means kids up through grandparents. And so a crowded household, the isolation that I described earlier is just impossible. We're not talking about people that are necessarily that sick yet. Of course, people that need to be hospitalized need to be in the hospital, but there are lots of people that are just sick and maybe have sort of cold symptoms, or maybe even be asymptomatic. And so they need to be isolated, and hotel workers that might be involved in helping such folks go through the isolation process, of course, need to be protected themselves with proper ability to do sanitation, sanitizing, as well as personal protective equipment.
Are there any last words either of you would like to offer about the report or how you hope it'll be received?
I would just say one thing about the concern that some lawmakers might understandably have about expenditures, because we're in a moment, the state generally likes to balance its budget, which is a prudent thing to do. And we're in a moment of declining revenues. So quite what we're calling for, hiring of hundreds of employees to conduct contact tracing and spending hundreds of thousands or more dollars to cover the hotel stays of first responders and in order to isolate patients. Those things are expensive. The problem is every month the economy is shut down costs the state billions of dollars. And so if we can spend millions of dollars now to save billions of dollars later, that's something we should do. If your house is on fire, you don't worry about water damage and mold, you put the fire out. And that's what we need to do.